Now, let's talk about how to save money on medications. For instance, get your doctor to prescribe larger doses of medications. In other words, if the physician wrote for your lisinopril to be 40 milligram tablet and the prescription were written one a day, but your actual dose proved out to be half a day, instead of having to go back for a copay at the end of the 90 days, and that's something the public should really fight for. Prescriptions should be made for 90 to 120, even 180 days. That message needs to get through to Congress, because people having to go back all the time to the pharmacy when they've been on a stable medication for long periods of time merely increases the likelihood that they're going to spend money otherwise that they do not need to, and that's what we need to be doing at this time. Yes, we should be shopping to a point, but I think we've all shopped until we've dropped the value of the stock market and our own retirement programs. It's time to get a little bit mature now, sort of live a little more with what we have, a little more conservatively, smaller cars, better mileage. Interestingly, I read a review of the Audi Q5, I believe it's called. It's a new all-wheel drive, small sport utility vehicle, which is akin to the BMW X3 or the Toyota RAV4 or the Honda CR-V, and it's all souped up and this and that, and it gets something like 15 to 18 miles to the gallon. That to me makes no sense. In these times, the auto companies ought to be making cars which are far more green and fuel efficient and less power. And you may say, well, the population won't buy them. We need to be told that we can buy these and should buy these because the cost of oil and gasoline is going to go up, and we should contribute to less usage of that, more energy efficiency and so on. But anyhow, that's all part of the program that this is, which is putting it all together. And to put it all together, you have to understand who you are and where you are in time and place. And that's what we try to help you with. We are now Americans. We are now in the midst of the Great Recession. They call it the greatest business downturn since the Depression in the 1920s and 1930s. And I think President Obama is generally doing well. I do think that things could have been done a little bit differently. I heard an idea that was interesting. Why didn't they cut the payroll tax? That would have had an immediate effect on those people who were employed and on businesses also. It would have gone directly into the pocket of the consumers, and that's what they're trying to do. They're trying to stimulate the economy. And I thought that was a very smart idea. Other ideas are apparently corporations in the United States are taxed second highest in the world. I'm not sure if that's a true statement, but if you want to promote business, you're not going to do it by taxing corporations. How are we going to pay for this health care reform? I'm trying to come through the back door and imply that if there's much less usage, then paying for health care reform is not going to be such a problem. There will be those people who argue, yes, you're going to keep people alive longer so that they can develop more costly diseases. No, there is a natural way of dying, and I have patients who do that. They get inexplicably sick with nothing to fix. Their heart seems to be okay. Their digestion seems to be okay. They just sort of have what I call DNA burnout. In other words, they sort of know it's the time. There was a great movie a number of years ago which dates me. It's called Mondo Cane, M-O-N-D-O-C-A-N-E. And that translates as A Dog's World. And I so remember this, it was somewhere in the Orient, where somebody was old and it was time to die, and they took them to these houses where the elderly went and realized it was time to just let go. And that is a natural way of dying. Nothing can be done. You just sort of get weaker progressively over about 6 months' time, and then that is the end. It is not that you need open heart surgery. It is not that you need your cancer removed. It is not that you need expensive chemotherapy. That is the natural way of ending a life. And you can be well right up to that last 6 months, and then, like I said, then there's nothing to do anyhow. Now, how often do I see that? I see it. I've seen it off and on for years. But what I'm trying to do is to get people to change their behaviors so that that is the natural method of dying. And you might say, well, what about all the people who have all these healthcare conditions now? Are they going to have a crack at it? Look, don't waste your time arguing against this. Start trying it out. Clearly, it's better not to have disease than to have disease. And if the Congressional Budget Office comes around and looks at it, then I will be glad to speak with them. And I have many other physicians, such as the editor of the American Journal of Cardiology and other people that I can call on to support the kinds of ideas that I'm putting forth on how to reduce diseases and costs at the same time. So now continuing on. Dietary nutrient composition associated with cirrhosis of the liver and cancer. And basically what they say is high cholesterol diet. There is no cholesterol in a brown rice, vegetable, bean, fruit, nut, and seed diet, and it can taste pretty good. You take some of those almonds and pecans and walnuts and you chop them up and you put them with some raisins or rice milk or juice in your oat groats or your rice, brown rice, white rice, some dried nuts. I had a meal the other day of barley with it was a barley pilaf. And it was really very tasty and very filling. I think anybody in the Hispanic community can tell you how filling rice and peas is. And any Jamaican can tell you the same thing, how filling rice and peas are. And these are the kind of foods that we need to begin to move towards if we want our health freedom and if we wish to rescue this problem with Medicare, Medicaid, and the whole high insurance crisis. Now, what about the rationing of health care, and what about the rationing of medical services? Something has to be done. The situation is out of control. But once again, you get around that by being well and not calling or needing those kinds of services. Here is an article that talks about intensive LDL lowering improves carotid plaque stability. Now, what I've just said there is if you get the cholesterol down very, very low, which is what happens on the kind of diet that I recommend, which does not happen on a fish, meat, chicken, cheese, egg diet, but this brown rice, barley, millet, quinoa, broccoli, cauliflower, carrot, onion, lentils, red beans, navy beans, apple, plum, peach, pear, almond, pecan, walnut. On that kind of a diet, there is no cholesterol. There is virtually no saturated fat. It's full of fiber, trace elements, trace minerals, high fiber. It's good for the bowels, and so on. And that is what is called for in our biology. So you can lower the bad cholesterol, the LDL cholesterol, and reduce the hardening of the arteries plaque here in the neck, which predisposes to stroke and makes it less likely to progress on to stroke.